We're going to begin as the council sitting as the Board of Health and get an update on COVID-19 and the county health planning. I believe Dr. Gales, are you going to lead it off?
Sure, happy to, unless Dr. Stoddard, would you like to go? Okay, I will move quickly and then put Dr. Stoddard on the hot seat. Good morning, everyone. Good to be here with you, and hope you're continuing to stay safe and made it through the holiday weekend. We will continue to look at our numbers to make sure that we made it through the holiday weekend. Fingers crossed. I will start with the numbers. For those of you who are following them, I know you all are, and for those at home, there has been some variability in terms of the numbers. We actually had a couple of days where numbers have been low. Yesterday, in fact, there were 34 cases reported, and which was the lowest number reported since April 4th, I believe. So, in quite a number of months. Now, this morning numbers show a case count of 163. And so obviously you're like, well, are we seeing evidence of an uptick? Well, based upon the epi statistics that we have so far, we think it's more of a reporting lag, given the variability in the numbers. And in fact, once we saw that, we had some intense conversations here to figure out, are we missing something? Now, certainly we will continue to monitor and follow. We've already initiated a conversation with the state to say, are you noticing any trends at the state level that would suggest that this is an uptick in cases, or more so of an instance of a reporting lag and a data dump, so to speak? Based upon the information we have so far, it suggests that it is more of a reporting issue as opposed to evidence of seeing an uptick in cases. But we will very closely watch that and monitor. And again, for those at home, in terms of how we're moving forward, I can't underscore how precarious watching the data is right now, and how sensitive the data is. You know, we have made tremendous strides, and we've gotten to the point where we do see a 3-day average. And, yesterday, without today's case of 163, we had a 3-day average of 47 cases, which is definitely where we want to go. The key is we want to get to the point where there is no variability, that number stays low, and we're not seeing, even in the case of reporting lags, we're not seeing a one-off day where we see a rise and then it coming back down. We want to see that number sustained and that number continue to decrease. So to give you some insights in terms of what we're looking for. Now, as it relates to testing, we have now tested 9.8% of our population, which is over 102,000 individuals. We've conducted over 115,000 tests at this point. The test positivity is 5.2%. We are averaging now in the county over 2,000 tests conducted on a daily basis, which is inclusive of all of the different tests from the healthcare enterprise, as well as those offered by the county. Now, given that the number has decreased again to level set where we are a month ago at the beginning of June, the 3-day averages were in the 250 range. I think June 4th, it was 255. And to give you a sense of where we are yesterday, again, the 3-day average was 47. Now, we're not saying, hey, we figure this out and we beat this. We're actually honing in, again, continuing to hone in to figure out the impact on, particular communities. One, we've done that geographically, and these are items that I will be sending to you under separate cover. Dr. Liu and his team looked at charted the top 10 zip codes with the most cases for each month since March. As well as breaking it down for those cases where we had race and ethnicity in terms of lab results. Now, when looking at the positive case rate per 100,000 residents from April, May, and June, we have actually seen decreases in the non-Hispanic white, non-Hispanic Black, and non-Hispanic Asian communities, while comparatively we've seen increases in the Hispanic community. And given also the geographic data, we've talked about this before, and it underscores continued efforts in terms of focused outreach to specific communities, both from a racial and ethnic perspective, but also as well from a geographic component. And as I mentioned, I will send that information to you all, because I can't share it on the screen, but I will send that to you all over email under separate cover. Now, in order to address this, we are continuing to work to expand testing in those areas. Now, our testing strategy, what we have been doing in terms of ramping up on a daily basis, we again with our testing buffet options. The stationary sites that have been in place for months now will continue to operate as scheduled. In addition to that, we are on a daily basis testing at multiple shelters, have assisted living facilities scheduled where we also are providing testing, as well as when there are, with the mobile testing arm being able to go in, we've talked with the D&D community as well. We had some conversations around correcting the PPE requirements and understanding around that, and we'll be moving forward in terms of being able to test at the homes on demand or as needed. And we also have opened up Dennis Avenue as a test site for individuals to be able to come in and get tested on a daily basis. Now, these are things that are in place already. And again, the other component is we have a number of county employees who are being tested. Department of Corrections went live with their testing yesterday. Fire and Rescue has continued to move forward with theirs, as well as test kits have been provided to the Sheriff's Office and our police units to be able to test their frontline responders and employees. So those things are in place. The things that we are adding and will be adding as they come forward and get solidified and scheduled will be the pop-ups that are in respective jurisdictions. For example, similar to what was done in Tacoma Park, there is one scheduled for Friendship Heights tomorrow from 2 to 6. We had a successful event at Middlebrook Gardens last week where we tested over 70 different individuals. And so as those get scheduled, we will be populating the calendar and letting you all know as soon as possible. Some of the other ones that are already in the works, as we've talked about before, are a testing opportunity in Silver Spring, as well as repeat testing at Tacoma Park, and again, continuation of those sites that are in place. Now, I know that we have also received input. Again, thank you, Councilmember Navarro, for your memo that you sent last week with recommendations of sites. We've had an initial conversation with our recreation team about utilization of the rec centers throughout the county, given the geographic diversity there. The team is actually meeting with them this morning to discuss what that would look like and how we can operationalize and stand those up. And what those would provide is being able to have regularly scheduled, an extension of our regularly scheduled testing sites that are stationary is not the right word, but are fixed sites that are open on multiple days throughout the week. And so that would add any of the pop-up testing in different venues would further add to the collection of options that folks have available. The ready responders who we are bringing back on contract will be onboarded next week. Our volunteers from Project Hope continue to work with us in all of those different testing options that I mentioned, as well as I mentioned before that we will be getting 2 trailers from the CDC. One of those sites will be at our Dennis Avenue Health Center, and the other one we're working on in Upcounty area. We had hoped to use the fairgrounds, but we've got an alternative site for that. Once we can finalize that, we will let you know. Additionally, the partnership that I had referenced that we are working with Prince George's County and the state for additional support from CDC for disease control and EPI, that team will arrive, I believe, on tomorrow and begin assisting both jurisdictions. Other thing I want to highlight is we continue working with the state in terms of contact tracing. We have our metric of contacting folks within the first initiating contact within the first 24 hours is at 95.1%. We hired our first wave of staffers through our contracting agency. We brought 12 folks on. We trained them last week. We now have 11 of them full-time, and they have begun contact tracing and assisting the team here. And we continue those discussions that I've mentioned previously with one community group in particular about embedding contact tracers within their organization, which will specifically focus and impact going back to the EPI data that I shared in the beginning of the presentation. One last thing to add is we are also, as part of the testing arm, working with a number of sites to be able to provide testing support to them so that they can offer tests to their clients. And some of those include some of our safety net clinics through Montgomery Cares and at least one other community venue who's looking to be able to provide testing and a stand-up option that they are leading and supporting. I will stop there. I'm sure there'll be ample questions and we'll be able to continue the discussion through that conversation.
Thank you. I have two council members who wanted to speak. Do you want to wait, Councilmember Navarro and then Councilmember Reamer? Do you want to wait till after Dr. Stoddard, or do you want to ask your questions now? Councilmember Navarro.
It's up to you, Mr. President. I just had a follow-up question regarding the testing sites, but it's up to you.
Well, then, and Councilmember Reamer, are you in the same situation?
I also want to talk about testing. I think it'd be fine to do it now, and then we can move on to the topics that Dr. Stoddard would have. Okay,
then Councilmember Navarro, please.
Thank you very much, Mr. President. Dr. Gales, thank you so much for that update. Specifically, as you just shared, statistics regarding the Latino community continue to be a concern. Obviously, there is a layer there to the zip codes that we have discussed, specifically speaking, of course, with Wheaton being a 20902 and being really the epicenter of the Latino community. I was informed by Ms. Luisa Montero that the testing site at the Wheaton Recreation Center, Library Center is no longer going to be providing the test, and that it's going to be now provided at Garage 45 at Amherst Avenue. And so I had not heard about that previously. I wasn't sure how that has been communicated to the community, but given the statistics that you just shared, what exactly are we doing then to strengthen? I believe that what I was told was in this garage site, there would be an additional, I think, 50 tests provided. But if we're seeing this trend continuing, especially as I said in the Latino community, how is that communicated in terms of the change of venue? And then how does this align with what you are intending to do in terms of increasing the capacity in those highly impacted zip codes?
Sure. So first and foremost, the information has been communicated through the call center in terms of when folks have been scheduled. And I believe through the county website, and I will go back and circle back on that one. And the utilization was to maximize space. Now that said, that does not knock out the rec center from being able to be used as a potential site to offer pop-up testing, or at least for the internal venue to be used to do the self-collection kits and mechanism on a regularly scheduled basis. So the goal is to expand and have multiple sites within the Wheaton area, not just focused on one. So as we bring them online, the expectation is that there will be multiple venues and sites throughout the community, not just one concentrated area that would provide multiple spaces for people to be able to utilize and get testing at the different sites.
I appreciate that, except that in this particular instance, it seemed to me like that was actually contrary to this goal, because to basically shut down the Wheaton Library Rec Center after that was sort of the site that we were communicating to folks that they should go to, and then move to the Garage 45. I looked for a Spanish language press release. I didn't find any. That works against our goal of making sure that the community know where to go consistently, right? And so that's why it was a bit confusing to me why that was done. And again, instead of just, if we want to expand, let's just go ahead and have the two sites operating, and let's do a very targeted, public sort of outreach and information to an area where at least we know geographically, right, that this is obviously where most of those cases must be coming from, so that we can encourage people to seek the assistance. So again, I was just a bit confused as to why that was done, the way it was communicated. Obviously, my office works very closely with this community, and we didn't know until we began to inquire. because following up on my memo. So again, I still don't understand how come we're not following the data in that way. And to increase the testing from 150 to 200 daily, I mean, 50 additional ones, it's a good thing, but I can't tell in terms of scope how much more that is, especially if we've closed, a previous site where people now were familiar with. That very much is aligned to this conversation about, people always talk about hard to reach communities, which I don't like that term, but the bottom line is that, we're supposed to, in my opinion, we need to be consistent versus shifting things like this. It only creates confusion for anyone. So again, and I was told that there was an issue with the rec library center. So that worries me because you just said that we want to have both, but if there's an issue and that's not going to be a site, then, where else are we going to place them?
So there are lots of issues that pop up logistically. And so the rationale behind adjusting the site was to be able to have a site and be able to, still function during the week while those logistical issues popped or were fixed and corrected. So I will confess, I will take ownership of the notification. We will work closely with you on that to make sure that that's addressed and taken care of. So duly noted on that, take full responsibility for that. As far as scaling up, again, we're trying to identify multiple venues within the space, because one of the things, actually a lot of the feedback that we got even when launching the Wheaton site was that it was still not accessible to lots of people in the community. And that's actually a lot of the feedback we got, even though we had these spaces in place, was that, well, people still can't access them. And so what we've been trying to do is to, again, continue those for people who can, but again, to identify as many other places as possible. And I was hoping to be able to announce today to say, hey, here's those 10 sites, we're continuing to work on those logistics, but it actually, very consistent with what you're saying is, we're trying to ramp up and create as many spaces as possible that are closer to the community. So for even those people who may live in the zip code and still have issues getting there with transportation, we're trying to stand up as many of those as we can to get to exactly what you said. We're in total agreement in terms of creating more spaces and more access points for people to be able to get in and do testing. So the goal isn't to remove any, it's to actually increase. And again, I apologize about the oversight in terms of communication. I know that's something that I don't think we have to relitigate the history that we continue to work with and deal on. And I take full responsibility for that. But I do want to say the efforts that we're trying to do are actually to expand the sites that are available to folks. And again, thank you for your recommendations that you provided. In fact, that has served as the basis of, particularly in the Wheaton area, of potential sites that we are having conversations and talking with leadership of those respective facilities and different things, like to be able to stand up, whether it's a one-off event for testing or something that we could stand up and do multiple days a week.
I appreciate that. I did send you also an email that I forwarded from a constituent regarding some issues with the testing hotline and the Dennis Avenue Center and things like that. And I hope in 311. So I hope that we're able to, circle back and make sure that those things are addressed. Sure. Thank you.
Thank you, Councilmember Reamer.
Thank you. I want to follow up on that same line of questions from Councilmember Navarro. I think she really identified some of the key issues. Councilmember Albornoz and I have been working together to talk about the need for a testing strategy to be written down and adopted by the County Council as a Board of Health regulation. I am finding it very challenging to try to understand and manage, from my obligation as council member, how we're doing this, from a 1 hour public session every couple weeks or a week and a 1 hour conference call, briefing. And the way that things are moving, how it seems like sometimes there's a decision that's made and then circumstances evolve and a different decision is made. Generally speaking, I think we have made progress, in my opinion, it could have been a lot faster, but we've made progress to bring capacity online for testing. We have lab partners that will process tests if we give them the samples, if we collect the samples from patients. We are not collecting enough samples from patients to meet our community's need on testing. I was recently reading the Harvard Global Health Institute, which put out a recommendation that a community's test positivity rate really needs to be below 3%. And in fact, a lot of the tests that are taken should be the result of contact tracing, not necessarily just random. And that when you achieve that level of testing and testing as a result of tracing, that you're really then on a path to suppress the virus versus mitigating the virus. And those are different for for a community. I was very it was helpful to hear that framework from the Global Health Institute, because it kind of clarified some of these key issues. And I know we've made progress, but we're still above 5% on our positivity rate. I think the suggestions from Councilmember Navarro, for example, about specific locations are good. I think we've got to solve this problem of walk-up test sites. I'm hearing a lot of concern from residents about their testing experience, and whether it is confusion about where to get a test or dissatisfaction with what happened when they went for a private provider recommended test. They couldn't get a referral, basically. I had one family contact me and say that they were not allowed to get a test, and they finally pushed through, and when they did, several of them were tested positive. So there's still some kind of inconsistency with what we would want and what the private providers are recommending. And I don't know really what employers are doing to test their workers. We know we want that, but I don't know if that is truly happening and what the county is doing to drive that. I had recommended last week, building on recommendations from many of my colleagues, that we open the fire stations in the county as walk-up test sites. And the theory being that because fire trucks leave stations and everybody kind of knows where they are, like that's a place that is very accessible and well identified. And of course, it's also distributed highly throughout the county. And we have people who are medical rescue, technicians and employees, and theoretically they ought to be able to support this kind of work. So I guess I wanted to engage with you, Dr. Gales. I'm interested to know what your view is of walk-up test sites at fire stations in a general, specific sense, or in a specific sense, but generally. Councilmember Albornoz and I have been working together to prepare a letter that would ask for a testing strategy to be written down. We appreciate a draft from the executive branch, but that the council should pass one as a Board of Health regulation, and build on a draft we might receive from you, but also be prepared to just enact one, that places sets up a program that we want to see achieved. So I know there's a lot there, Dr. Gales, but to welcome your comments and thoughts on that.
Sure, I'd be happy to respond. Thank you for the series of questions. I think first and foremost is part of a pandemic or emergency response does require being flexible and nimble, and having to make decisions on the fly when the environment changes. And I think examples of that, for example, as data comes in, having to be able to respond quickly and put in policies and strategies that address that. I think one that you're very well familiar with in terms of face coverings, in terms of when it was discovered that asymptomatic individuals could transmit. When that was announced, within a day, we actually had already put into place metrics for face coverings, but within a day, there was clear guidance provided, for example, to nursing homes in terms of how to change their practice in terms of requirements of PPE and face coverings and testing of employees. So there are times where it requires to act quickly. As it relates to, at one point I want to clarify, so for anyone watching who may have had issues or problems with their provider providing a referral, we created a mobile helpline that's been in place for well over a month now, that if individuals do encounter that issue, they can call to our Dennis Avenue site and get access to testing without having to have a referral from their private provider. So that provision has been in place for a number of weeks now for individuals. So if you have anyone calling your office who's had resistance from their private provider getting access to testing, we can take care of that and provide a referral. And in fact, it's a standing order with my name on it, so I can assure that they're going to get tested. Now, the third component as it relates to mapping out how we're going about testing. So we have looked at a number of venues. So in fact, venues such as the Firehouse and other places we've looked at over a series of months. We've combed a lot of different and thought of a lot of different both clinical spaces as well as non-clinical spaces that would allow for the opportunity to offer testing. Now, one of the sites that I mentioned that we are talking about today is the utilization of recreation centers. That would, they are geographically distributed through the county. Maybe not to the level of firehouses, but there's a lot of them throughout the county that has a lot of penetration and access for folks that would allow for a high number of folks to be able to come through and get tested on a regular basis. And so I have also reached out to my colleague in DC, Dr. Nesbitt, to find out more information about how they're utilizing their fire stations. But consistent with their approach, again, they have multiple spaces where people can access and get testing, similar to what we've done here. And we're working again to create as many options and spaces for people to be able to utilize, not only on a daily basis, but also across the continuum, being able to, have testing at sites in the morning, in the afternoon, as well as in the early evening. Again, some flexibility in terms of options. So what we, again, creating the full spectrum of all of the different things that we have in place. So yes, there is a plan that can be written, but I want people at home to understand that we have an exhaustive list of options available for people to test that actually is more than a lot of other jurisdictions in terms of our stationary sites, our mobile testing, the helpline, use of the ready responders, as well as we're bringing in the pop-up sites to be able to add spaces as well. We welcome and continue to welcome ideas or suggestions within that, and we will continue to study the viability and the feasibility of utilizing those sites, because we have the shared goal of testing as many people as possible. And yes, it is accurate that the desired test positivity for any situation is to be below 3. And we are at 5.2%. In fact, multiple days this last week, our testing positivity, actually yesterday, was 1.9%, because we had 34 results out of over 2,000 tests. So we are moving in the right direction, and certainly, yes, we want to test as many people as possible. And in a perfect situation, you're also accurate. Yes, contact tracing would lead to testing and getting people tested. Right now, given the situation where we are, I think there's more of a focus on universal testing as opposed to waiting for folks to be identified as a contact and saying, hey, the assumption is that everyone out there could be potentially carrying COVID-19. And so now, with not only the CDC, but the recommendations that we put out as the county and that the state has also put out for private providers, there's clear language for individuals who are asymptomatic to be able to get tested, so that individuals such as the family that you referenced won't meet such resistance when they get to a primary care provider or an outside provider, and they can get tested more quickly and easier and smooth.
Thank you for that. So I do think we should proceed with drafting a Board of Health regulation. Appreciate your offer to, your willingness to support that. I think we've got to get to the point where we have thousands of hours of walk-up clinic, walk-up site availability. Today we have about 20, maybe 30 hours per week where you can walk into a site and get a test. There's 3, maybe 4 sites. I think having 20 to 30 sites where they're open 12 hours a day would open the doors wide enough that we could then communicate to the community, go get a test. Like, go get a test. You want to travel? Go get a test. You want to visit your family? Go get a test. Like, ubiquitous testing. And I don't think people believe that that is yet what they should do or can do. And, you know, that certainly would be, I think, a game changer. Also, another key issue is the employer issue. You know, I don't know that we are aware of to what extent employers in the private sector that have frontline workers are following what guidance we think they should be following. I know we issue the CDC guidance and we want employers to follow that, but are they? And I think having an initiative to bring employers together to try to drive that message and communicate about what the public health requirement is for testing, and then having widespread availability of testing might also be very useful. So thank you. As I said, I'm working with Gabe Albornoz, and we'll follow up with you on the idea of a Board of Health regulation as a testing strategy for the county.
Thank you. Dr. Gales, I failed to ask in the beginning, are you under any time restraint?
Actually, today I'm not. So
okay, all right.
I guess I shouldn't say that out loud.
I was going to say, you probably, I was going to say, you shouldn't tell this group that. Okay. Well,
I missed you guys last week, so.
Yeah, I'm going to go to Councilmember Albornoz, and then Councilmember Friedson and Glass are also on the list, but I believe both of them are going to wait for Dr. Stoddard to give his presentation. But Councilmember Albornoz.
Thank you, Mr. President. I'll start with the very good news. First, Dr. Gales, thank you for the collaboration on the special appropriation for the medical practices. I do think that will make a significant difference and support our public health infrastructure, and especially excited about the innovation component of that special appropriation, which I think can lead to planting some seeds after COVID on enhanced public health infrastructure across the county. Also want to express my appreciation for the pop-up site at Middlebrook and Tacoma Park. Those are very good examples of what we need to be doing a lot more of. And, you know, I know how hard you and your team worked on those. And I do appreciate that we continue to have the standing locations. But as Councilmember Navarro and as Councilmember Reamer indicated, you know, I think that the frustration, well, for context, yesterday I had the opportunity to visit the Quebec Terrace apartments. There's a gentleman named Mario. He received one of the grants that we appropriated to do food distribution. Mario is a resident of the Quebec Terrace apartments. He has a small taxi cab company that he runs with 2 colleagues. And as a volunteer, he has been delivering food to these families. And I went into one of the apartments. It's a family of 7 living in a 1-bedroom apartment. And they have no access to a vehicle. And they suspected at one point, at least a month ago, that at least 3 of their members of their family had the virus, but they never got tested because they didn't have the ability to be able to go to some of the locations that we had stood up, and didn't know where to access the information to be able to receive the tests. And, you know, that's just one small but important example of the complexity that so many families are facing and that I know you're aware of. But we've been talking for months, as you indicated, about standing up these testing sites. And I know that you have worked diligently with your team. And I'm also aware of the complexity of standing up these sites. It takes a lot of work. There are a lot of logistical elements and coordination with the state and the biolabs, and there's the medical side, but then there's also the practical communication sharing. And I worry, Dr. Gales, that you have an incredible team that's working around the clock, but I just don't think you have enough hands. And I think that's a challenge. And so have you been able to, and the council has been saying for months now that we are prepared to support enhancing your team to meet the demand. And as you said, it has been a moving target. Up until 7 weeks ago, there literally weren't the tests to even be able to administer, let alone the coordination of the logistics. But that problem has eased. And now the logistical challenges remain. So is there a need for us to provide additional logistical and administrative support to free up your team to have a point person in each of these individual areas, and in particular these apartment complexes like Quebec Terrace, where we know there are still rampant numbers of cases, and probably more than we realize, because again, many of these people have not been tested. So could you respond to that staffing infrastructure? And honestly, do you feel like you have sufficient hands in place to be able to go from planning to action?
Sure. Thank you. That's an excellent question. And so the short answer is we never have enough staff. But to that end, part of the planning process that has been going on behind the scenes, and again, Councilmember Ringer's point earlier, we meet in this hour-long session on Tuesdays and then on Fridays. There's copious amounts of stuff that's going on behind the scenes, and we don't always share those details. But one of the tasks that the team has been working on is presenting models of what the staffing components would be to stand up these different sites. So everything that I mentioned to you in terms of all of the different options we're pursuing, one of the components of that is a human capital assessment. And so, for example, the models, we have staffing models for what is, given we have a new system, you're right, because we didn't always have the capacity to do it, but given the new system, particularly as it relates to self-collection, now that we have multiple events that we've done, we have a good sense of what the staffing components and needs are. And so that has been mapped out. And that is an ask that we are, submitting to say, hey, here's what we need. And here's what we would need, for example, from county employees who are working from home or could be repurposed and reassigned. And so that's coming, as well as for example, the appropriations that were made for contact tracing. We are utilizing those funds, and we've hired our first wave of folks already. We're going to hire, probably ramp up and triple that number utilizing that particular contract, as well as exploring, again, working with another agency to embed at least 20 to 25 more contact tracers within that group. So the short answer is yes, we have now that, as the environment has changed, we have models, staffing models and needs that are being looked at from county HR perspective in terms of additional resources and staff members that could be supported. And the funding that you all have appropriated and provided is being used. And I anticipate as this ramps up and continues to ramp up, we will be utilizing those resources even more.
I appreciate that, and I know a lot is being planned. I know a lot is being worked on, and to Councilmember Reamer's point, seeing it in writing, beyond just a description within the briefings, would be helpful, but mostly to the stakeholders in the community partners that can then see that, know that it's coming, can anticipate, acknowledging there's going to have to be an asterisk, there's going to have to be a footnote, that things may shift, but to at least people know that a pop-up test is being planned in their community within some reasonable time frame. And then allow stakeholders, connectors like this gentleman Mario I met yesterday, to be able to work with you and your team and the leadership within your team to help get the message out, to help get the correct message out. Which can be very difficult in a number of these communities who already are very untrustworthy of government, as we've said many times before, to begin with. And we need folks like Mario to be the intermediary to really get to the families who desperately need these tests. And not only from a moral perspective, a public health perspective, because these are also the same folks that are going back to work. And so that makes it even more important moving forward. Mr. President, I did have two additional questions not related to testing, but vaccines and another question. I'm happy to defer that, or would you prefer that while I have the floor, I ask those questions now?
No, I think you should please wait.
Okay.
We have Vice President Hucker that is wants to speak on this to Dr. Gales, and then I'll put you, Councilmember Albarnaz, on the list for after Dr. Stoddard speaks. So there's others in front of you, but I'll be then. Okay.
Thank you.
Thank you.
Thank you, Mr. President. I so much echo what Councilmember Navarro and Albornoz and Reamer said. Dr. Gales, just a quick follow-up on the issue of testing scheduling that you were addressing. My understanding from HHS staff is that they're touring the Civic Building in Silver Spring today to get a quick walkthrough, and then it'll be announced when we're going to do the long-awaited Silver Spring pop-up testing.
Yes. So what happens is if a venue or an organization says yes, they're interested in testing, is the team does do a walkthrough to again assess what's the human capital need, what what entrances need to be, all that kind of stuff. So they are doing that today, and once we can get that nailed down, we'll be able to announce and move forward.
Okay, I just didn't understand the dependency. Why not announce the date, knowing that this is a big building, that's a public building, and is widely available. And this is the top priority of the county, and then do the walkthrough and figure out all the logistics.
Well, I mean, a large part of that is the logistics will determine, the capacity. So if we get in and determine that the space could, hold 500 folks versus 100 folks, again, when we announce the information, we want to be able, to the point earlier, make sure it's accurate. It's fact. We have a sense of what the staffing model, all those kinds of things need to be. So it is done very quickly, for example, in a venue like Silver Spring, to say, here's a visit, and then we can launch from there.
Okay, that's fine. I'll defer to your judgment. I'm still stuck on this question of that others have raised. I don't know the answer whether you need additional staff or whether the very large, executive branch staff that we have in multiple departments are adequately focused on supporting you, because I get different information, it seems like, every week. But, whatever we can do to get the full executive branch, the weight of the executive branch focused on supporting you, I think this is, job one for all of us. So thank you, Mr. President.
Thank you. Councilmember Friedson to Dr. Gales, please.
Yes, thank you for that. I echo all of the comments made by colleagues about testing capacity and by Vice President Hucker on the need to provide you with the resources that you need, including having the executive branch adequately focusing on what has to be our top priority. I don't want to belabor that, but I just wanted to associate myself with all of those comments. I did want to thank you, Dr. Gales, for the pop-up you mentioned in Friendship Heights. Appreciate you working with the Village of Friendship Heights, with my office, and with other stakeholders to make that happen. Key area, transit proximate, which is critically important as we talk about access, and also in the middle of a naturally occurring retirement community with a lot of older adults who are vulnerable. And so I really appreciate you all stepping up to do that. And I just wanted to note that. Question with you, do we have an R0 number, the latest R0 number, and where is that trending?
Sure, give me 1 second. I will pull it up. So the R0 numbers from July 1st, again, as we talked about before, it's really looked at in a 7-day approach, given the variability, as you see, from 34 to 163. So the R0 value, the most recent one to share, it was 0.81 and 0.9.
So the long-term trend is that we're staying below 1, but we haven't necessarily reduced from where we've been.
So the trend is we are staying. There are some days, again, you can imagine with the report of 160 cases from today in terms of the data drop, it will fluctuate probably a little bit over 1, but for the most part, the majority of the days we are below 1, and usually within the 0.8 to 0.9 range. Got it. Okay. And appreciate that. And I think it would be helpful if we could, I've been asking for this, and it's not necessarily a question that, only for you, but if that could be shared publicly with us and with the public on the website, I don't see any reason why we wouldn't share that and let folks know when it gets updated, like we do with some of the other data. So while I'm here, I'll just mention that. Additional question for you. There's been a lot of discussion, and we've been talking about this repeatedly since the early onset of this public health crisis, but about the nursing home question. There was a major Washington Post story about this, but the question of shutting off admissions to nursing homes in order to control the transmission of this. I just wanted to get a sense from you. There were some significant number of Montgomery County sites that were referenced, including
frontline healthcare workers at Potomac Valley who talked about how they were begging the senior staff there to shut off the admissions, and then referencing certain other jurisdictions like St. Mary's that did at the first case of COVID in nursing homes by local public health orders shutting down the admission. I know we talked about these issues and related issues quite a bit, but I just wanted to get your thoughts on these issues, the fact that these continue to be concerns of residents, particularly those who have loved ones in these facilities, and just wanted to get a sense from what your perspective is of how you approach that issue, what it would take, for a decision to be changed on that, why we've done what we've done, and any thoughts about any changes perhaps moving forward on those issues related to applicants.
Sure. Well, I think in terms of nursing homes, and I extremely value my colleague in St. Mary's, Dr. Brewster, who is the health officer there. We are in a different situation. We have a lot more nursing homes than they do in St. Mary's County, and so it's a little bit of a different environment. And so there are clear, criteria that nursing homes have in place in terms of accepting new admissions, particularly individuals, even bringing back folks who had been in their homes and sent to the hospitals and then being released back to the nursing home situation. So I think, and in addition to that, there are strict guidance and guidelines that have been put into place in terms of those facilities, in terms of reopening and being able to meet those goals. So we continue to work closely with the facilities on that. We work with the state in terms of enforcing and emphasizing those requirements. I'd be happy to have a conversation with you offline from this venue to talk more in detail about specifically what questions you may have, or to talk more in depth about our response and strategy around that. I think, again, to provide some historical context, when we had our first cases, we implemented the action team to work with them. And we've continued to work with the state teams. The state is currently providing universal follow-up testing for those facilities that continue to have cases. And we have continued to provide guidance for those facilities as they are discussing and considering reopening their facilities.
Okay, and do we think that the issues related to the transmission rates in the facilities are going up, going down, staying the same? Do we have understanding of what that looks like?
Yeah, so in fact, we actually are working closely with some of our EPI consultants from GW for some time now in terms of a congregate living facility special work group. So each week we go through and we look at the numbers to show which places still have cases, as well as which spaces still have more cases versus others. And the strategies that we've implemented, again, I think a big part of this is the having availability for serial testing. And again, we were stepping up ready to do that when the state has stepped in, and the state is providing testing for those facilities that continue to have cases. I think that's a big factor in terms of mitigating transmission, because it's not only testing residents, but it's providing testing access to all of the staff and being able to identify any continual cases, but also being able to triage and identify any new cases that could be potential sources of transmission.
Okay, well, if you keep us posted on that, I'd appreciate it, and I'll follow up offline for additional specifics in the interest of time. Thank you.
Thank you. Dr. Stoddard, would you please give your presentation?
Good afternoon. Thank you for having me back. I do have a few things I want to highlight. So first off, I do want to, obviously, I think many of you are aware of the good news this morning for Novavax, which is a Gaithersburg-based pharmaceutical company that did receive a $1.6 billion with a B award from the federal government on production of vaccine efforts between now and hopefully the end of the year. They're hoping to go into phase 1 trials by the end of the week, which is great news. It's obviously great news for the county. It's great news for us in this response. Obviously, a vaccine would be a huge tool in the toolbox to be able to address the coronavirus long term. So obviously that's good news, and obviously we're very supportive of it being a Gaithersburg-based company, and very much hope for success in that arena. A couple other updates. So 311, we continue to see about 260 calls has been about where we are sort of our new set point that we've come to over the last couple of weeks. About 11 to 12% of the total call volume most days. Similarly, about 285 calls overall for all call types in Spanish, about 12% call volume there. Social service calls still remain considerably higher than they did a year ago. We had 472 social service calls yesterday, 19% of the total call volume, and that's up from about 5% of the total call volume a year ago at the same time. So that's obviously a fourfold or greater increase. We continue with our child care distribution. So the next distribution will be on Saturday, the 11th. We're going to do a month worth of PPE and cleaning supplies for our child care providers at both our Dennis Avenue and Gaithersburg site, the public safety headquarters. So child care providers are welcome to come by and pick up resources, cleaning supplies, PPE, infrared thermometers. Those who haven't gotten those already can certainly pick up. We continue working on a lot of recovery-related activities, obviously, while we're concurrently responding. A couple big ones. So our community recovery advisory group's first meeting will be on July 14th. We have about nearly 50 participants on that group across all of the particular stakeholder groups, incredible demographic diversity, our LGBTQ community. Across the board, we've got really broad representation to give us feedback on how we're, doing reopening, how we're doing recovery, and that moving forward. Elijah Wheeler from the Collaboration Council is going to be serving as the community chair for that group. And we have our first two meetings. So again, the 14th and the 28th, we'll have meetings to discuss collecting community feedback on our recovery process. I also do want to highlight quickly that Dr. Gales and I did meet with Montgomery County Public Schools Deputy Superintendent McKnight last week, and we are both actually going to jointly do a walkthrough of one of the school locations on Thursday morning. Obviously, the school system has shared their preliminary plan, and we've seen a copy of it and been asked to provide feedback on sort of what they have been planning to do. And I think it's important for parents to understand that there's a range of ways that the fall could go, and the virus will dictate a lot of the way that will occur. I think everyone prefers, and I think the American Association of Pediatrics has strongly stated that in-school education is of extreme benefit to students. I think we realize that from a youth development perspective, from a getting people being able to go back to work perspective, but at the same time, school environments must be safe to operate, and we appreciate that. The school system appreciates that, and so we will be doing what is in the best long-term safety interest of our students, and making those recommendations in that manner to the school system to move forward. We have made a series of submissions to FEMA, particularly to get policy rulings on some of the costs associated with employee pay, particularly. We're also working on a next package of those reimbursements, particularly as it relates to PPE, that should go out hopefully over the next week or so. We did bring in some outside consultants to help us do that, because obviously we don't have as much experience, and I'll knock on wood saying that that's a good thing, applying for major disaster declaration dollars, as some other jurisdictions do, and we want to make sure that we maximize our opportunity to recompense the dollars. Not we would do this otherwise, but we also know how important it is in this particular time that every dollar that we get available to the county can be a dollar that can go towards helping our residents, businesses, and others respond to and recover from this event. So that's certainly our goal. I want to talk about enforcement a bit. We had a meeting yesterday afternoon. We actually had a meeting before this past weekend, when I know the media has picked up on some of the stories related to some actions that either some businesses have taken or I guess in some cases not taking, and as well as some actions the county has taken in closing other businesses down or citing other businesses. And so obviously I want to say first and foremost that the vast majority of businesses that we have interacted with have been extremely cooperative and extremely interested in making sure that they protect their clients and visitors. And so we thank them very much for those efforts. And when I say the vast majority, I'm talking the vast majority have been doing exactly what they should be doing. In some limited cases, either through lack of knowledge or in most cases, even those who were not compliant just made a mistake and have learned from that mistake and are now doing well. There are a select few, however, who are putting profits ahead of people's lives, and for that, we're not going to permit that. We are going to be out enforcing, and in cases where we find people who are being wanton in disregard for the public health orders, those businesses will be cited, and if those citations are deemed as being just the cost of doing business, they will be closed. And that's simply the way things are going to have to go. We do not want to close businesses. We just want to see compliant, safe operation of our establishments in Montgomery County. But obviously, we can't, from a public health perspective, allow businesses to disregard the public health orders in trying to make some statement about whether they disagree with the face covering order or what have you. Those are and have the force of law, and they will be treated as such. And frankly, in many cases, the violations are not solely Montgomery County violations, they're state violations. And so I want to be very clear about where we stand in terms of enforcement, and thank the vast majority of businesses who are doing exactly what we have asked them to do and what they know to be right to protect the lives of their employees and the visitors. I'll stop there.
Okay, is that everything? Councilmember Gladys.
Thank you very much, Mr. President, and thank my colleagues for all of their good questions. I too had some questions about the senior community centers, healthcare facilities, and appreciate Councilmember Friedson for asking those. But Dr. Stoddard, you ended with a thought that I want to address, and it's regarding compliance. We are seeing record numbers of positive cases throughout the country because communities are opening too soon. The residents and the business owners are ignoring the data and the science, and they are not social distancing and not even wearing masks. Blatantly just going about their business as if there is no global pandemic. And here in Montgomery County, as you mentioned and has been mentioned in some media, there have been some restaurants that have been non-compliant. There have been a number of hookah bars, a lounge, and most notably now a restaurant in unincorporated Gaithersburg, who the owner of which said that they will not have their staff wear masks. And so I'm curious what the compliance has been. You mentioned it's been generally good, but what has the reaction been when residents are calling 311, as I've been directing them to do when they see non-compliance? Can you talk a little bit more about how systemic this might be and how our agencies and departments are going about trying to correct these wrongs?
Sure. Thank you for referring people to 311. That's certainly where we want them to go. So what happens when they call 311? Those are sent to HHS's licensure and regulatory, which Dr. Gales oversees. And from there, they're shared with a team of people, depending on the nature of the concern or the complaint. If it meets the level of sending out an HHS inspector immediately, that's what happens. If it's related to a bar or a restaurant, it may be ABS inspectors and or HHS that's working together. In cases where and so all of them are followed up with. And so depending on the nature of the concern, they're followed up with either via a visit or a call that day or subsequent days thereafter. Now, what I would say is, and we had some enhanced capabilities, where we've heard a lot of concerns, and I think this should be very clear, is what we've seen a lot of is where restaurants are operating late at night is a particular area of concern. And so after the dinner period is over, and they start to operate more like your traditional bar might, that's when many of the most significant violations have been both observed and reported. Not to say that we're not seeing in retail establishments and other locations intermediate reports, but I would say the vast majority of concerns that we've seen raised have been in the restaurant sector, particularly as it relates to the consumption of alcohol around bars. And so that would be the vast majority of areas where we've heard concerns raised and had to do compliance visits related to. Now, when we go out there, many cases, the observations when we arrive, obviously we see what we see when we get there. And so we can't know what had been done 2 hours before, but we know what we see when we get there. In many cases, the non-compliance is maybe not complete wearing of face coverings, maybe 5 feet of distance instead of 6, not egregious violations where education is the appropriate mechanism. And we educate them, and then we typically do a follow-up to ensure that that education has taken hold. Now, obviously, and so we very much appreciate residents reporting this because we can't be everywhere at every time. And so residents' eyes and ears reporting back, particularly when they see things that are particularly unsafe. Now, we are also pairing up this with education because, as you said, in many cases, it's businesses not realizing what they're expected to do in some cases. And so we are having, we're working on a strategy, a collective strategy. I know we've talked about, testing plan. We're working on a similar plan for our enforcement because we realize that there's an education component and there's a citation violation process. And we're trying to do both of those things together. We know we had a great success with our ambassador program, and frankly, we're likely to bring it back in a separate, another iteration because we went out to nearly 3,000 businesses. We received enormously positive feedback from that program, from our businesses, to say that it was very helpful for people to be out there talking to them. And I suspect we're going to be bringing it back in another form to do education, and then simultaneously pairing that with the back end for those businesses who are flagrantly disregarding the rules, not just not aware of them, to have the citation.
And Dr. Stoddard, with regard to people who are witnessing flagrant violations, people have sent me links on Reddit feeds, and other areas of social media. Are those types of online media enough to warrant a violation, a fine, or a stern warning? What happens if someone captures something versus seeing it firsthand?
So it will depend on the nature of what's observed. So, for example, as you well know, all of this has to stand up to scrutiny of the legal system as well, right? So it comes down to what's the strength of the evidence associated with whatever the violation is. Now, people have asked, will you ever get a citation for a first-time offense? And the short answer to that question is it depends. If you are egregious in your violation, you may get a first-time citation. In most cases, if it's a marginal violation, there will be education component. We're not looking to be punitive with businesses to the extent that we can be, but as I think I've said before, we will not allow. And so, to answer your question, is it depends. I wish I could say it more concretely than that, but it could be in some circumstances that we had video that we knew was from a particular event, or we had enough eyewitness reports of an activity, we could come in and make an action based on that. That would not necessarily be a universal rule in all cases, though.
I appreciate that. So then let's just be very clear that if people see improper actions, sure, take photos, take videos, so that you can call out the offenders, but then call 311 so that the county staff can get on site and correct that action as quickly as possible.
Absolutely. I think we were keenly aware of the incident that occurred on Facebook over the weekend with one of our restaurants, and having observed and read through many of the comments, I think I was heartened by the fact that many of our residents recognized that was not behavior that they could support, and they made it very clear to the particular business who posted that. But on the back end, the county is also aware of that posting, and we'll be taking the appropriate action to follow up with that to ensure that what was referenced in that Facebook post will not proceed. I mean,
I appreciate that and appreciate your action and public statements, you too, Dr. Gales, with regard to making sure that not only patrons, but also employees, of these restaurants are protected while they're trying to make a living. Let me just pivot just real quickly. One other question. Someone has contacted me who owns a photography studio and specializes particularly in photography of newborns, which is a timely subject. And they were asking whether or not they are able to open and provide their services to families.
I believe I'm aware of this particular call, and I want to make sure I give you the right answer. So I'd like to give it
follow up with
you, but I know particularly one of the concerns was as it relates to this. I mean, when we originally discussed this very issue, and I think it's the same one given the way you described it. The initial issue was, well, okay, you could probably do good physical distancing during photography, but as I recall, this was a newborn, and you have to pose the newborn in a certain way, which requires closer interaction, and we don't recommend use of face coverings for those under the age of 2, and so that it may be a very nuanced example where it may not be appropriate given what the requirements of that particular business are, but we'll follow up to confirm that.
Great, I appreciate it, and thank you all very much for your ongoing work. I yield back, Mr. President.
Thank you, Councilmember Rice.
Well, thank you very much, and I want to pick up on something that you said, Dr. Stoddard, and then also swing it to Dr. Gales as well. So, if we have businesses that are openly violating not only local but state, because my understanding is I'm looking at the website for Maryland Commerce, and it says that face coverings are required when interacting with other staff or guests. I mean, it's very clear. It's on the website. So they're not only violating local, but they're violating the state ordinance by the governor as well. Why do we then need to do 4 rounds of checking to see if they're not, adhering to policy? And then on top of it, when you talk about egregious, I mean, there's nothing more egregious than saying, and I'm not going to do it. So what? I mean, it doesn't get more egregious than that. I'm trying to figure out what else we would need to do in that sense. Now, again, I understand we're not trying to pick fights here, and I'm not trying to make examples. I'm not trying to put Montgomery County on the map of the national spotlight and have the president. But the reality is that this is an example. I mean, we're either setting an example and saying that we're having folks adhere to these policies, or we're not. And there is no gray area. I mean, it's very cut and dry. And so if someone could just explain to me how this doesn't rise to the level of the most egregious, and this place should have been shut down and fined from the beginning, I just need help in understanding that.
I certainly would like Dr. Gales to chime in on this, but I think he and I are on the same page that this restaurant will not reopen. Once the post was made, they were already closed. They were closed of their own volition at that point, and my understanding is that they don't reopen until Thursday. They will not reopen on Thursday under the circumstances of what they've posted. Now, so just to be crystal clear about that. And so this is a perfect example of where we had gotten a report last week that they had, face covering compliance issue. We went in and educated them. The post was made after the visit, as I think the post was alluding to. But once we saw that was the atmosphere or the attitude of the owner operator and how they were going to proceed, that absolutely changes the calculus from it being a educational to a enforcement action based solely on that posting. And so, to be clear, that facility will not open again under that premise.
Understood. Let me just, and before Dr. Gales jumps in, let me just say that, so when we went out there and talked with them the first time when we had interaction with them, I'm assuming that was not the response we got, and they immediately
Correct.
Put on masks? Okay.
Correct.
Okay. All right. Dr. Gales?
I was just going to add, great question and observation. The state has been notified because I think it's important for folks at home, as we actually had a conversation earlier this morning, is I think there are times where the county is made to seem that we are out of step in terms of what the state allows, but we've been very clear that the violation in this instance violated not only what we put forward at the county level, but also violated the rule in terms of what the governor's rule has been put into place. So the state team has been notified. We've worked with them in this particular situation. I don't want to go into details about this in case we happen to find ourselves in litigation or related to that. But what I can say is that, at least from the health perspective, is that we are looking at all of the potential remedies that we have in place, not only for this particular situation, but any of the situations that pop up. And we'll be happy to talk with you offline about it in more detail.
Yeah, it's just incredibly concerning. And I know that the council president is concerned about it. It's in his district and it borders mine. And so certainly one in which, just from a parochial standpoint, in terms of trying to mitigate against any kinds of outbreaks, we already had a gentleman lose his life at the McDonald's in Montgomery Village. So we know that we're not immune in this area from losing people who are working at restaurants from contracting COVID and the potential of transferring it to other employees as well. And so from that perspective, I mean, we're talking about life and death here. We're not just talking about somebody's individual freedoms and rights that they proclaim is higher than the laws of the state of Maryland. And so from that perspective, I just really want to make sure we're on the same page. I did want to follow up on a question that I'd asked you guys before, which was access to cleaning supplies and others. And so, Dr. Stoddard, I'm very happy to hear that you said that we're doing that for our early care providers, and that's fantastic. But when it comes to access for some of our businesses that are out there that are still trying to access, and it's getting a little bit easier, but it's still a challenge to get access to quality PPE as well as cleaning supplies. Have we been able to make any progress when it comes to helping our local small businesses that are out there that are basically relying upon Amazon or, you know, some of our big box stores to get them what they need, that oftentimes is delayed or is not available at all?
Part of the work of the ambassador program was actually to provide PPE out into the field with many of our small businesses. And so whenever we conducted one of those 3,000 visits, if we found people who didn't have enough PPE, we actually provided it as a direct provision. Now, obviously, it becomes extremely challenging if the county is going to have to support the PPE needs of all of our businesses, the county and nursing home. Like, you know, there is obviously a limit to our ability to acquire the resources. We've been very successful in getting them ourselves, and we have been, I mean, when I say we've been more out, you know, put out more PPE than anyone else that I'm aware of, state, regional, we've gone way beyond many of anyone else. And we'll continue to do that, but at a certain point, you know, we start to run up against our own limitations as well. So I do want to make sure that that's clear.
No, I appreciate that and understand. And I know there's only so much that we can do. And it's just, you know, whatever we can help them with is great. I just have one last question, Mr. Chair, and it relates to our schools. And just curious, and this is more, I guess, for Dr. Gales, but you also, Dr. Stoddard, since you guys both talked about it in terms of reopening our schools. There's been tremendous discussion, not only around the safety of the children themselves, but also when it comes to their families, whether it's parents or grandparents, and then also the health of our staff. And so being that there's a lot more conversation around indoors versus outdoors and the risk associated with indoor congregation versus outdoor congregation, obviously with our HVAC systems in many schools that are very antiquated and are not at the same level as which they should be when it comes to purification, nor moving the air as efficiently as in some of the other schools. Have we looked at that at all as precursors for where we might want to be more stringent versus more lenient when it comes to how many children, where they are, all those kinds of things. Have we gotten into those kinds of details yet, or is it more just generic at this point?
MCPS has certainly gotten into those level of details. I mean, I don't want to get ahead of sharing where they're at necessarily beyond where they're comfortable with, because I know that they're also talking with their staff and making sure that whatever they say, their staff are comfortable with too. I know that's sort of an ongoing thing that the school system has undertaken, but from the draft plan that they've shared so far, they've gotten into those level of details and certainly are very concerned about the same thing and how they, can deal with that in the context of some of the aging infrastructure that they have as well. And so I don't want to, I certainly think that I'd be more comfortable with them sharing the details of their plan, but yes, they've gotten into it.
Thank you. Thank you, Mr. President.
Thank you. Just as a time check, and Councilmember Jawando has not spoken, so he will not be under any time constraint, but we do have Councilmember Albornoz and Councilmember Navarro who also want to speak again. And we have 15 minutes because we're supposed to go to have the virtual brown bag lunch with the regional service centers directors at 12:30. At 1:30, we have 8 public hearings, and we're very tight because we have interviews afterwards. So Councilmember Jawando next, and then I'm going to ask Councilmembers Albornoz and Navarro to please limit their conversation to as quickly as they can. Councilmember Jawando.
Thank you, Mr. President. No pressure.
None whatsoever. None.
Yeah. Thank you, Dr. Gales, Dr. Stoddard, for all your work. I always want to start that way because I know you're working we all know you're working very hard and have the best interests of all county residents in mind. Totally want to associate myself with the testing capacity questions and concerns. Obviously, I'm glad Councilmember Albornoz brought up where I used to live in Quebec Terrace and those apartments, and we toured those with Councilmember Reamer and some others a few months back as well, and a whole bunch of issues going on there. But this is certainly an issue that underscores a problem throughout the county of these multifamily housing units and folks who are not getting tested, have gone through issues. I was talking to a family last weekend in White Oak with very similar story. And we have to get a handle on this as we enter a whole new phase. It's interesting. We're in this kind of awkward, as hair growth gets in an awkward phase and everything else, we're in this phase of kind of open, but not really. And what do you do? And what do you wear? And how can you go? And where do you sit at the restaurant? And as all that happens, I think as at the same time, I saw a map the other day of all the 40 plus states that have had increases, and Maryland was not highlighted, but everyone around us was. And you just think about how long can we hold that at bay? I'm really proud of what we've done here and what you all have led as far as the steps we've taken to mitigate that. But I think we're at a very vulnerable time, particularly as it gets hot and people go outside. There's just a lot of factors going on, and the ability to have massive availability of testing, particularly in communities that we know have been under tested and have not had access, and all the steps we've been taking together to address that. I just want to underscore how important, and I know that's been talked about, and I know you get it, but please let us know. I've been talking to Dr. Crowell about ways, not only in the testing, but once we identify people, how can we help them, whether through our hotel strategy or other ideas that we're working on to get people separated. How do we ramp up the contact tracing? I know you're working on this all day, every day, but it's just so important, especially at this critical moment. I did want to ask about the travel restrictions. I've been getting some questions from folks when I talked about that map. There are some states where when you enter, you have to be quarantined. You can't come in. I'm not aware of that in Maryland at this point, but I want, for people who have questions about that, is that being discussed at the state level? Are you thinking about it at the county level? Where are those conversations? I guess this would be to both of you, or Dr. Gales first, about those types of restrictions going forward.
Sure. It has been introduced to the governor's office. When we had our health officer meeting last week, actually, I pushed that forward. So I sent the question up to say, is this being considered? I was told I would get some feedback. I haven't heard anything yet, so I'm not sure it is something that the governor's office is considering. We have had internal discussions here in terms of what that looks like. I have also polled and surveyed the health officers across the National Capital Region as well to see what is not necessarily the appetite, but what efforts are being put into place. At this point, I don't think any jurisdiction has put forth anything. We have discussed it from the perspective of potentially in terms of if there are, first line responders or essential employees who may be going to those jurisdictions, in terms of putting in restrictions for them when they come back. But nothing has been formalized yet, but I can definitely attest to something that we have talked about at length. And it will probably be ongoing because unfortunately the number, as you pointed out, the number of jurisdictions who meet those criteria or concerning criteria has increased over the last 3 or 4 days.
I appreciate that. Please keep us posted. That's something that I'm glad you raised it with the governor. I think, we need to consider that as the Board of Health and as the county and, as a state and as a region, as you said. So I'm glad those conversations are going on. Please keep us posted. The other thing is, last question I have for now, and I'll follow up offline on a couple of other smaller things. We still, and it's my understanding, we still do not have the data, not only by zip code, but by race of the cases and deaths. Do we have that specific level data of by all the demographic data that we need as far as who's been tested, who's been contracted, and who has died by race, ethnicity, and location? Do we have access to all of that?
Yes. So the death, so the information that you described for deaths is more complete because it's pulled from vital records. And so the deaths by race has actually been posted on our data dashboard site. It's towards the bottom of the page. It's easy to miss, but it's towards the bottom of the page. And the death data is by age and by race. We've not put it up by zip code, but we could do that because we do have the home addresses of those who have passed away. And so as it relates to who's been tested in terms of that data is limited. So the state puts together a weekly compendium by race. In terms of, I know it's done by case. And so by case, I want to say we have race and ethnic data for probably 60 to 65% of the cases. It's missing in some. And so from that information, we've been able to try to piece it together on a jurisdiction level. And so that's actually a part of what I'm going to send you all by email refers to the case rate that Dr. Liu and his team here have taken that information and put together, and you'll be able to see the trends for cases per 100,000 residents by each month and how that's changed.
Okay. Thank you. Thank you very much. I look forward to getting that. Thank you, Mr. President.
Thank you. Next is Councilmember Albornoz and Councilmember Navarro. And I hate to always do this.
I know. I got it.
Okay. All right.
Thank you, Mr. President. And I am in the awkward hair growth phase to Councilmember Jawando's point earlier. Just a quick question. So I'm not confident if this administration gets a second term that there will be a national strategy on the dissemination of vaccines, and that we will, just as we have been with testing, be effectively on our own. And so it is incredible news that a local company has received the $1.2 or so billion grant. But Dr. Stoddard, have we reached out to that company? Are there plans to reach out to that company or others to engage in a discussion about whether or not the county can be first in line to have access to some of these vaccines?
I know we've had conversations with them in other contexts, obviously not since this morning's announcement, and I certainly think that's something that we're going to follow up on. And just to add to your point, I am confident that there will not be a national strategy around dissemination of vaccine if this administration continues. So I think your point is extremely well taken. Dr. Yels.
And to that end, I won't make any political comments, but I agree with what you both have said in terms of a strategy, because there's been no strategy, period, verbally or written, for any of this. But from a vaccine standpoint, recognizing that, and we're not going to wait to see who's elected or not elected. Our team at Dennis Avenue, the disease control team, has been working on a vaccine distribution strategy for several weeks now, recognizing that we hope that moves forward, and we hope that we have a viable candidate by the end of the year. And so as we think through our strategies for flu vaccination clinics and things like that, I've asked the team to think about how we could integrate a COVID vaccine within that and what a larger distribution and dissemination plan would look like.
Thank you.
Okay, thank you. And Councilmember Navarro, he came in under budget. Councilmember Navarro, please.
Thank you. I just wanted to point out, I didn't mention at the conclusion of my remarks earlier that there was some issues that were brought up to my attention regarding the testing hotline and 311, et cetera. Somebody just sent me a tweet from the Department of Health and Human Services that indeed the Dennis Avenue Health Center phone service is not working, and that this includes the testing helpline, and they're working on that. So it is, I guess, confirmed that there was some issues there. And just want to obviously ask that as soon as that is resolved, I don't know if it has been already, but I didn't, okay, that's wonderful, because I had not received a response to my message yesterday, but I'm glad that it has been resolved. And if this happens again, if we can just get, notified so that we can let folks know what's going on. Thank you.
Thank you. And thank you, Dr. Stoddard and Dr. Gales, for being here with us.